little after 3, and I'm sure some additional people will trickle in, but let's get going here. So welcome everybody. I am Abby Garrison. I am with United Way here in Chattanooga. I'm the Vice President of Venture Forward, and much of what we do at Venture Forward is capacity building and innovation work, and really kind of advocating for the nonprofit sector. So we have ended up doing handling a lot of the outreach component of trying to let people know about the Tennessee Community Cares Act. So thank you for being here today. As you probably also know, United Way is the administrator for our region. So we've had an interesting ride, kind of sitting on both seats as outreach and also on the administrator side. So I wanted to quickly kind of introduce the rest of our team who's here today. We have Ada Bobbitt, who's our coordinator here at Venture Forward, and Patrick Miles, who's our Director of Innovation. He's also on here. And then everyone's waving, that's great. Dominique Brandt is our VP of Community Impact. That team is very involved in the much of our grant making in the normal process, and certainly under this program as well. And then last but not least, we have Patsy Higgins, who is our grant administrator, oftentimes grant writer, but also in this case, leading the charge internally. Yeah, she was probably the main reason we were able to say yes to the state that we would administer this, because she has an incredible amount of experience on both sides, handling federal and state grants. So yeah, she's a wealth of knowledge. So yeah, you can't deny that, Patsy. No, don't argue.
Well, a wealth of knowledge, but perhaps not in the CARES Act. So
well, yeah.
as we will discover.
As we're all discovering. We're learning by the minute on the CARES Act.
Absolutely. And I wanted to thank Abby, and particularly also Ada and all of our team, because they have been trying incredibly hard for outreach and make sure everybody knows about this. And I welcome all of you. I know I've met a lot of you via email and your questions, and for those I haven't met, hi, nice to meet you. What we're planning to do today, I'm not going to spend a whole lot of time on what CARES is. I'll do a really brief description. And I will also tell you, we're going to be taking the questions in the chat. If I don't know an answer, I'm not going to answer it. I don't want to, the last thing I want to do is give you any misinformation. And I think we've all discovered that some of the guidelines, as they're clarified, are different than we originally thought. And that's something that none of us enjoys, either as an administrator or certainly not as an applicant. So we will try our best, and I'll call in Abby and Dominique and to tell you what we know and what we're attempting to do, and do our best to answer your questions. And we know there are many. The state of Tennessee, this is how I understand it works. There's money from the federal treasury that 150 million has been earmarked by Governor Lee for nonprofits in the state of Tennessee. That's to cover the whole state. Initially, we thought we would know exactly what our United Way the amount we have, but that changes a bit, because one of the goals is to spread the money throughout the state and make sure some of our rural counties get some, and certainly our cities. So it's a fluid number. So I can't answer how much we have exactly, and that will all work itself out. The other thing is, to the credit of the Health and Human Services in the state and the consultant they're working with, Horn Associates, they've been learning on the job, as we all have. So that's why, again, sometimes you've gotten answers and those answers change. So we will do our best to get you where we are now. As you know, the deadline is Saturday at 11:59 p.m. and I'm sorry, that is Central Time. So that's where we are. There are a couple things that we found out. We were on a webinar this morning, and one of the things that came up was the reimbursement issue of, do you have to have paid the bill before you're reimbursed? The answer to that was yes, which was at least from what I have been previously understood, that as long as it was incurred, meaning that you would be paying the bill, that was okay. But at this point, it stands that those bills have to be paid by November 15th in order to get reimbursed. I did check, or not check, but I have sent in a question to the state and asked them once again to clarify that, because I've seen it written in two different places as different answers. So that we really want to make clear for you. So having said those things, which isn't a whole lot at this point, I do want to start answering questions because we don't have a whole lot of time. Ada, can you move to the top, or is that not possible?
Your first question is, please clarify about salaries.
Okay.
Can we include the percentage of time personnel have spent or will spend on COVID response, even if those salaries were already in the original annual operating budget of the organization?
Really good question, and comes up a lot, and it's because it has one of those answers that's a really fine point. In your operating budget, you have salaries for people. So let's say you have an administrator and they get a certain salary. They have certain job duties, and that's why it's in your budget, and it was approved by your board, and that's all good. When COVID came along, let's say now that your executive director or your president said, hey, person that's an administrator, we're going to pull you out of that job and have you do some on-the-ground COVID response. If that happens, then the salary or the hours that person spends directly on COVID, that is reimbursable. If it's, so when it says it can't be in your budget, well, it can't be in your budget as that, as their regular salary, but you would have to document the hours they spent on COVID response. You would have to have some description of what is it that they did that was outside of their regular job duties. I can give you an example that we at United Way, one of the things we did, our 211 system was overwhelmed. And so some people were pulled out of some other positions and trained in how to answer some 211 calls. Well, because that was different than what they normally do, and it was a direct response to COVID, then that kind of thing would be reimbursable. Does that answer that question? There has been a lot of confusion about that. And it can be part of, it doesn't have to be all of somebody's time.
I'm going to just go down the list.
That would be easiest, Patrick.
Okay. In building our criteria for paperwork for clients served through our program, we are unsure if the funds would allow us to serve undocumented residents, or do we need proof of residency?
You do not. My understanding is that those sorts of the information that you keep on your clients is yours. What you will need to show is some evidence of how you, for instance, if you're giving out, you're paying somebody's rent, or giving them money for a car repair, whatever it is that your program has, you have to show that that's what you did. But we don't need, or the state doesn't need information about the actual person, their address, where they live, that kind of thing. It really is, I guess one of the things to keep in mind is that this is an emergency response. It is not to sustain agencies, and there's been confusion on that, with payroll and operating expenses. It's not meant to help your organization survive. What it's meant is to get needed services out to people who need the services. So it's different than many, many programs that most of us have seen, in that the rules are a lot more flexible. And that's part of why there's so many questions. It's like, well, we can't usually do this. Can we do this now? Very often the answer is yes. And I also tell people, look at the ineligible expenses. It's a really short list. So if it's not on there, put it in. You know, this is different in terms of other grants as well, that we can go back to you and say, hey, we got some clarification on this and you're not going to be able to spend it on that, and then we can fix it. So that's much different than if any of you have applied for grants before. You know, once it goes in, you can't do anything. This is very different. We want to work with you to get you what you need in order to get it to the people who need it. So that's a really neat feature of it, and something we're looking forward to in terms of working with you when we review the applications.
Hey, Patsy, before we move on, I just wanted to make one point about the previous question about payroll. I think you guys all already know this, but I think it's worth saying again that you can use it for payroll that you're, you know, shifted around, but just make sure that it's not for payroll that you got PPP for.
Right. Right.
So,
Good
you know,
point.
that's one thing they're going to be looking at extensively, is whether there've been other federal funds that have funded particular expenses, and you cannot double dip under any circumstance. So just wanted to make sure people knew that.
Thanks, Abby. Yeah, that's a really important point, because we actually, as part of our review process, we have to check with the state and the feds to see if there was anything that was duplicated. So please make sure that you don't do that.
Okay, next question says, this is a common one, I think. Tennessee Cares Packet communicates dates from March 1st through December 30th for items such as reimbursement for past and future expenses related to COVID. Emails and initial discussion use the end date of November 15th. If I'm calculating known and anticipated expenses, do I end November 15th or December 30th?
Oh my, good question. Everything has to be all the money has to be spent by November 15th. However, as was clarified for us this morning, and people who were in on that conversation can join me if I misstate this, but if you, I'll use an after-school program as an example. The after-school program goes till the middle of December. But you bought items and you got them paid for and did all you were supposed to do by November 15th. The fact that you have items left that will cover through December 30th is fine. What you can't do is spend money after November 15th. So anything you do that goes to December 30th has to already be paid for. If that made sense.
Great. If we are applying to provide rent and utility assistance directly to those affected by COVID, is this considered a quote unquote direct cost that we can calculate a 10% or less administrative fee from?
If you can clarify that, are you talking about it would come out of your 10%, or do you get 10% on it? If you put it in as an expense, then you can put your 10% administrative fee on your total. You wouldn't need to take it out of your 10% if that's the question. Maybe I'm not understanding. But the 10%, my understanding as an administrative fee, would go on your total budget.
She said that he answered her question, so there you go.
Okay. Right.
We generally host schools and field trips from Hamilton and the neighboring counties. Would equipment and new staff to create a digital experience for those schools be eligible?
The money, if you had to purchase, let's say you don't have the equipment to do virtual things, that's all, yes, you can spend that money. If you have to buy a platform, if you have to buy equipment, that is all reimbursable as long as you spend it by November 15th. But that's very common, is that people were doing in-person programs and now they're going to be doing them virtually. The staff cost, however, that gets trickier. If you were paying people anyway, for instance, to do an in-person class, you cannot charge their payroll now to the fact that you went virtual, unless what you're doing virtually is directly, let's see, you're doing a prevention program for COVID or something. But just the fact that you switched from classroom to virtual doesn't necessarily change the position that the person conducting it is doing. I don't want to confuse with that, but it has to be directly COVID related. But the setting up the virtual is certainly reimbursable.
They did add in that webinar today that they clarified that if you're going to make pretty big kind of infrastructure expenditures, that you should articulate in your narrative why you needed to make that, like why you needed to purchase it versus just rent it, for instance, or why you had to have that thing in particular.
Yeah, and that's another excellent point. If you need to hire new staff, or you want to build something, or your narrative is going to be extremely important in connecting what you want to do with why you need the money. Really, the focus of that narrative is, why do you need this for COVID-related activities? And if you can make that case, you're good. And that really will be one of the big factors is, did you need to do this in order to address COVID and its effect on the community? If you tie that together, you're good to go.
Okay, a common question here is, the $25,000 minimum still the minimum that you can apply for?
Yes, it is. No, it's still $25,000. There was a rumor at the beginning of the week that caused us no end of headaches that had been eliminated. It has not. But what I will tell you is, if you already put in an application and you put in less than $25,000, we will be contacting you and seeing if we have some ideas of how you can get to that minimum. If absolutely there's no way you can get to that minimum, your application will still be scored, but you'll lose, and I can't tell you how many points it is at this point, but you'll lose a lot of points on your score. And that may or may not affect your ability to get funded. With the number of applications we've seen coming in, my guess is that money's going to go. So it may severely impact. So if you can, and we're by no means encouraging things you shouldn't be doing at all, but sometimes you don't think of, for instance, you can spend it on hand sanitizer to have a supply of that, or masks, or, maybe you have a direct client program where you're giving out money for rent, or for utilities, or for, whatever that person needs. Maybe they need some medicine that's not covered, whatever your service is able to provide. Plus, remember, you can go back to March 1st. So for even small agencies, getting to $25,000 doesn't seem impossible. So if you need some help with that, when we're reviewing your application, we'll certainly see if we can help you figure out how you could do that, because it'll just increase your chances of being able to get the money.
I think you've already answered. There are two follow-up questions to the deadline, the November 15th deadline. Says, in our proposed budget, should we differentiate between costs already incurred and those costs that we project between now and November 15th?
Well, if you're going back to March 1st, you wouldn't, when you put your budget in for whatever program you're asking that you're going to be performing, or you're asking for approval, you would, in most cases, I'm thinking, be going back to March 1st. If it's something new, then you wouldn't, obviously. But it would just be one budget. Help me here, Abby or Dominique. I don't see why you would separate that out, because what's going to happen is after your budget gets approved, there'll be something called the CAM system, which is how you'll get reimbursed if you don't need to be reimbursed for it, because you've already, it's not something you're asking for reimbursement for, then you just wouldn't be asking for
I
reimbursement.
think the second question will answer the confusion there. It says, can we pay in advance for services that will be delivered after November 15th? If so, for how long? Like, for example, can we pay for a 1-year service contract that will be paid in full before November 15th?
Okay, the way it's worded from what I've seen in the federal regulations is you can do that if it's your normal process. If you normally pay, like, I don't know, a copier lease a year ahead of time, then it would be acceptable, even though you're only going to get paid for that period of time up until December 30th. So one of the examples that was given was a lease for your building. So you might sign a year's lease, but the only thing you can be reimbursed for is from the expense from March 1st to November 15th. So in any event, whatever you spend has to be gone, or has to be, you can't count anything after December 30th in terms of what you did. Again, I'll use hand sanitizer as an example. You have hand sanitizer left over. Can you give it out after December 30th? Sure, it's already been paid for and it's sitting around, but you can't order more out of these funds because they would already have been gone.
Patsy, is another way to answer that, would it be that something like rent or a service contract would be prorated for however many months it's in effect?
Yes, that's how I would answer it. If one of the things we asked this morning was, can you pay December rent? Yes, you can, as long as you pay it by November 15th. So I will clarify that with our people about the proration. That seems the most logical, because that was with the example they gave of a lease, how they did it. If it's something that's like a yearly fee, it may not be something that you would prorate. So that one we will definitely get back to people on, because I tell you the truth, I'm really not, I'm not sure enough that I want to give a firm answer on that.
This next one is, we have a home energy efficiency education program. Due to home energy bills increasing by 20% since COVID, we're reaching out to more people who are seeking utility assistance and to provide this education. So program funding has been cut due to budget cuts. Can we apply for salary coverage for those individuals?
Let's see if I get this. So you're talking about you're doing a program that will help people with their cut their energy bills, or be able to manage their energy bills. And the reason that the bills are going up is because of COVID. And this is a new program, or
it's an existing program.
I think it's an existing program, but I think that what they're saying is that they are expanding it because of COVID, because the number of people who are needing support and assistance. And so they need to hire on additional staff in order to provide the rise or scale of
okay. Then if you're hiring on people specifically to do that, that would be covered to November 15th. If it's people who were already doing a program and you changed it to be more COVID focused, I don't think, it doesn't seem like enough change in the duties. The duties really are the same. It's just what they're talking about may be different. I think that would be, I don't know what other people think. I think that would be stretching the intent. But certainly you could hire somebody to, maybe you're doing a short-term program to do that. again, that's something we could clarify, but I'm thinking that it's a position you already have. They were doing the program anyway. They've just changed their focus. That wouldn't be additional duties. I don't think so, but we will clarify.
That one probably comes down to the narrative too. The piece about
yes.
like energy bills have increased 20%
Yes.
since COVID. Like if you can really make that case, right?
Yeah. No, I think you're right. The average reasonable human being, whoever that happens to be, needs to be able to look at it and say, oh yes, I see why they had to do this. And the clearer you can make that, then the better your chances are of getting those funds. But it would have to be really clear and really persuasive to explain to me why this person's duties are different now, because now they're doing this focus on the energy savings.
Just to remind everybody, it's 3:27. We still have a long way to go,
Okay.
but we have lots of questions, so just be
Sure
patient.
we do.
If we don't answer your question right away, we'll get there. Just be patient. Are there any requirements, guidance for the budget format attached to the application?
No, there's no template. There's no, just your, whatever your normal operating budget, however you have that for your agency, you would send in. And then for the budget, for the, whatever it is you want to do, I've seen it in all kinds of formats, but no, there is no prescribed format on that. Whatever's easy to read and explains, we can look at it and figure out what it is you want to spend and what for.
So a follow up to that, I think it says in here, would providing rent and utility assistance to individuals affected by COVID be considered a direct cost that we can calculate an administrative fee from?
Yeah, that's similar to the one before.
Yeah, I think we may have captured
yeah,
that.
that's anything in your budget you can put an administrative fee on the total.
All right, next question says, the final question of the application asks about other COVID funding. Does this refer only to funding for the proposed project or for any COVID funding received by our organization?
I don't have the application in front of me. What the intent, again, going back to intent, the intent of that is to make sure that you're not double dipping, that you're not asking for the same reimbursement for out of two different programs for the same thing. So if you received PPP or some of the other programs that were out there, as long as there's no problem in saying that you did, as long as there's nothing that that you didn't use those funds for what you're asking for now. That's really the key to that, because you're signing that in affidavit too, saying, or that there's no conflict, that you have answered the questions truthfully, all that stuff. So if you got money and you used it on the program, you can't ask for it again for the same things. Did that answer that?
I think so.
Yeah, I think so.
Okay.
We're just going to keep on rolling. And if that does not answer your question, guys, just post something else in the chat and we'll try to respond to that.
Okay.
Is the grant request all or nothing? In other words, can there be a portion that is actually awarded instead of the full amount?
That's not necessarily something that the administrator agency decides. That really will be the result of once all of these are in and everybody looks at how much money was requested. If the request exceed the amount of money available, then yes, there could be a reduction in what your particular application asked for. If there's enough money to cover it and it's been recommended from the administrator that it be covered, then that likely wouldn't happen, but it really will depend on how many applications come in and what the total amount is as to again, I know the state is trying to make sure that the money is distributed equitably, and so how they do that is open, I guess.
Patsy, another way of asking that question that I've had asked of me is if an organization applies for, let's say, 3 different things, kind of 3 buckets, right?
Mm-hmm.
And the administrator determines that one of those buckets is just not fundable. Can the administrator still approve the application, send it to DHS for the 2 other buckets? Or does that one thing like just throw the whole thing out?
No. That, I mean, that is the advantage. What we would do in that case is we would talk to you and say, you know, we really, these 2 programs you have in here, we think are appropriate and fundable, and we're going to make a recommendation. Well, that those are, we're going to say that request is appropriate. The other one, you know, we think for these reasons, that's not really what the fund is intended for. That's not a problem in terms of application. No, we wouldn't turn the whole thing down because there was one part we didn't like. That would be a discussion item. And I can't emphasize that enough, is that we will be happy to speak with you about, and you'll be able to make changes. You can say, okay, well, we'll just take that out, or we'll say we're not going to do that. However, we, you know, we have to track, if we do that via email, we have to send those to the state. If we have phone calls, we have to, you know, make notes on what we talked about. But we want you to get the money for the programs that are meant to be on the ground and help people and help your staff, and how all the other ways that we can address the pandemic. So we're going to work with you the best we can.
Next question says, in the section of the application that asks, how will these funds be used to respond to COVID? If one picks reimbursement for expenses incurred due to COVID, does that negate the next few questions specific to numbers served, desired outcomes, etc.?
Negate as in you don't have to answer them?
Because I think it has to do with reimbursement as opposed to.
That's similar, it sounds like, to that other question. I would answer all the questions, and the reimbursement piece will happen afterwards. So you would at that point have to show us what you spent, and what it is you're asking to be reimbursed for. So as far as the application goes, just you would just answer the questions with whatever. I don't think you need to be concerned whether it's reimbursable or not, whether it's already been reimbursed. If that was what, I'm not sure I'm getting it if I didn't answer that correctly.
There are a couple questions I'm gonna have to skip over because I just don't feel like we have the right wording here. We'll come back to them if we can. We provide 24-hour care to intellectual and developmentally disabled individuals. We have increased our pay for all staff during this time as a hazard type pay to ensure staffing. Is this something that would be reimbursable, and only that increased pay?
Again, you would have to draw a really strong link to why that was necessary. Why do you have to pay more? Is it related to you just can't find staff, or is it because there's something that's you have to you know, there's more protections in place in order to keep people safe? If you can connect it to that, then that expense would be reimbursable.
Okay, next one says, would you explain the recent financial statement and statement of activities underway and planned to date?
I would if I understood the question. Are you asking what do you need to submit? I really, I'm not sure.
Maybe these are different documents.
Can that person just restate it again, like rewrite the question more fully?
Yeah, that would help.
Okay, we'll come back.
Yeah.
Okay.
One of the programs we have begun or been involved in is helping the helping to move food from farmers who otherwise wouldn't have had to throw it out to needy families. I saw in the FAQs that food requests have to go through Second Harvest. Our request for the food program is all our labor incurred as a result of helping organize distribution and actual distribution, not cost of food. Does that still need to go through Second Harvest?
I would think the way that's described, it's more, if it weren't food, it could be something else. I would agree that it's not, you're not asking for food. You're talking about the transport of it. You're talking about how it would be distributed. So if in fact, if we receive that and it looked to us like, oh, this really is a Second Harvest, you know, they need to deal with this, we can do that. I would just send it, given that, you know, if you substitute the word food for, you know, for anything else, I think that would be, you're talking about transport, you're talking about the labor. You're not saying we need food for 20 people or something like that.
I also think just seeing who that's from, you know, you have to think about where the bulk of your application is going to go, because they don't want you sending in like 2 applications.
Right.
So if that's just one component of like a multitude of things that you're doing, like definitely, yeah. I would submit it to us. Through us, it all goes to DHS first, and then it trickles out to the administrators. So they'll weigh on it one way or the other.
Yeah, that's probably a good follow-up question that may or may not be on this, but that is, if the $2 million cap is there and they have maybe 3 different programs or applications that maybe go above collectively combined $2 million, do they still, nope, they're all together. Okay. That's what we have to.
Do they still, I'm sorry, go ahead. Do they still
work? No, can they still apply individually and then, or do they apply in one application for all 3 programs?
Yeah, you apply in one application. What you can't do is have separate applications that add up to more than 2 million, or even one application that adds up to more than 1 million, because 2 million, because that's the cap. Anything $1 million and above will also be subject to review by the state directly. But 2 million is the cap, no matter how you put it together. But yes, we would prefer one application.
All right, to make double sure, I love that. Can we hire a short-term contractor for the capacity of the program? For example, legal assistance for tenants facing eviction.
You can absolutely put in your application what you plan to do, how it's connected to COVID, and how it will be spent by November 15th. Yes.
Okay. We are writing to purchase temperature verification kiosks for our schools. How cool is that? It will be one large payment. The kiosks may not be available until late October or early November. I understand that we're supposed to report monthly, but I won't have expenses till the end of October or early November. How do I report the months that I have no expense?
You know, we're not familiar with the CAM system at this point, but there may be, and we can check, there may be a way of you report in and say, we have no expenses this month. I don't, the only danger I see in that is if for some reason it goes past November 15th. But if you're reasonably sure that you will receive it prior to that, then I'm guessing there's a way to say, I don't have any expenses this month.
Okay.
I think you would definitely want to articulate like how confident you are that that's going to happen, though, because one of the things that they have just reiterated over and over to us is if the money does not get funded or spent by the 15th of November, I mean, essentially they have to give it back.
Yeah.
So that is like, they want administrators to be very sure that the dollars are going to get spent by the deadline.
Okay, this one has to do with service areas. Is each grant administrator limited to funding requests that benefit its service area? For example, an organization that serves an additional 10 counties outside of those areas served by like United Way, for example?
Yeah, no, there is no, the reason that you were asked to submit to your local or closest United Way was just to make sure that no one got slammed disproportionately, but you can submit to any of the administrators, with the exception of the food bank, unless it's food related. So no, it doesn't matter what county you're in. You can, it doesn't have to be to the local United Way.
And one other point, again, you guys probably know this, but just to reiterate, it's only for counties in Tennessee.
Yes.
So that we're in the
yes.
tri-state area. So just be sure that your beneficiaries, we're talking about Tennessee residents only.
Yeah, absolutely.
Just to follow up on that, can Georgia nonprofits apply if they help support Tennessee residents?
That actually came up in the webinar this morning. Yes, as long as you can prove that the money that you, Georgia agency, that you are spending it on Tennessee residents.
Interesting. Great. That's been a question that's definitely come up. You mentioned that we need to state our case and tie it back to COVID. The application does not include a list of expenses incurred. So am I right to assume that if we are selected and begin putting in invoices, receipts, there's a chance something would not be approved? Hopefully that makes sense, is what they're saying.
It should be in your budget. If your budget is approved the way that, if it's not approved the way when we first look at it, we would talk to you about it. But if your budget is approved and you're recommended for funding, then as long as you're doing what you said in the budget, it should be approvable or reimbursable, I should say.
Okay, it says on the earlier call that we hosted with Jim Catanzaro, he stated that the $30 million to $40 million could be coming to this area. Has United Way been given a specific amount of funds to distribute?
We have not. We just asked that question this morning. Initially, they had talked about telling each area how much would be earmarked for them. But I think what has happened is that as applications are coming in, they're being very careful to make sure that it's equitable. So they have not given us an amount to use. So we're just going to, when we approve things, send them in as they are, and then see what shakes out of that. So we don't know.
Okay, this is there are two questions here that I kind of relate to the same thing. Is it possible to apply for the grant while our DUNS number, DUNS number, or our CAMS system are still pending?
Yes. If you don't have a DUNS number, and you make note of that, because I know that's on the application, it only takes a day or two to get a DUNS number. So as long as you have that in before you ask for a reimbursement, I'm sure you'll need it before you get set up in the CAMS system. But if you don't have it, send in your application anyway.
Will the CAMS system automatically create an account for those who submit applications?
Yeah, you won't. Yes, you won't have to do anything. That'll all be set up by the state, and then you'll be notified with your access information and password, or not password, but that an account's been set up for your organization. So you don't have to do anything at that point.
I think we skipped one about the admin fee. So just to clarify, the 10% administrative fee is available to grant applicants for the potential grantee's administration cost. It's not just for the grant administrator. We're not getting
correct.
10%, so yeah.
Correct. Yeah. It's just like any many grants. You can put in your, you have overhead cost and you have indirect cost and all that kind of stuff. So the limit on what you can ask for in that is 10% in your grant application. That does not come to us. I mean, the funds don't come to us.
This next one, I think, is coming from people who are used to grants, right? For budgets and stuff like that. And by the time we get to do expense reimbursement requests need a budget or a line item of expense? See how it's different? Like a budgeted expense or a line item of expense? Trying to understand that.
Yeah, I'm not sure. Whatever your budget is in the application, which should be line items, then if that gets approved, that's what you'd be asking for. Unless
Okay.
I'm,
Hey, Jim, go ahead and unmute yourself here, and if you need to re-ask that
Okay.
question in a different way, that might help.
Probably confusing the whole thing because of this. When I hear on the drop-down menu for how the funds will be used, there's support for school-age children, activities for individuals or family. You know all the ones there.
Right.
On the line of reimbursement for expenses incurred, to me that's a past thing. Something that was incurred that was related to COVID that affected the organization. How do I write a budget for something that's already happened that's not connected to a current or future program? Well, it only impacted all of them. I guess I'm confused. So I said line item, do I just turn in a list to say, here's all the things that we purchased?
Okay.
We'll save for the employee.
I think I got you. So you're talking about, say, from March 1st till today, you have spent $50,000 on something
Hand
that's
sanitizer, whatever.
Yes, okay. And you're asking for that, but that's separate than the after-school program you're going to start. That You're
Correct.
also, yeah. You would just make note of in your application, say, we're requesting for this $50,000 we already spent on hand sanitizer. That's one piece, and then we also want to do this. That all goes in the same application.
All right, that yeah, not a problem. So
Okay.
we'll have concurrent, and you had said buckets earlier, and I thought I was like, oh, I think I'm going to have to explain both. Got it.
Okay. Thank you.
All right, this next question is, agencies were asked to estimate their grant amounts in a recent survey. If that amount has been totaled, did it exceed what United Way has been allocated? I think you've answered this a little bit.
Yeah, we haven't been allocated, so I can't answer that.
Next one is, we are including Sequatchie County to assist with rent and utilities, et cetera. Is anyone else covering Sequatchie for these needs? I don't want to overstep, but have been asked to make sure that they have some support.
Even if, we haven't, number one, not everybody's submitted, but we haven't looked at all the applications yet. There may be somebody, but that doesn't stop you from putting it in. I live in Sequatchie, so I'm a little more interested in that. But yeah, I mean, you can go ahead and do that. That it's certainly going to be a need. So whether others do it or not, I'm sure there's enough to go around in terms of what the need is in any of those rural counties, particularly.
Eligibility question. I plan on having a mental health program for first responders that have been affected by COVID response stress. Would this program fall under this grant guideline?
I don't see why it wouldn't. You're talking about it's directly COVID related. It's a service that people will certainly need. And again, your only caveat is got to spend that money by November 15th.
There's a lot of people who are interested in that program regardless. So
yes.
they might be busy.
Absolutely.
What is the timeline for approval of applications?
The timeline is we, the administrator, have to have everything in place by August 24th. And then the state will be spending 2 or 3 days reviewing all of those and then letting us know what the results are. How you get notified, we're not really clear on whether the state will do that or we'll do that, but you should know something that that week of the 24th, probably 26, 27, 28 maybe, but it'll be that week. It's ready to roll.
It looks like we only have 2 more written questions, and then we can try to open it up for maybe a couple minutes of audible questions. But This one comes from a university. It says, funds are only for Tennessee residents or those who are in Tennessee. So I work at a university that, of course, serves students from all over the country. Do I need to divide the total reimbursable expenses by the percentage of students from Tennessee to get a refundable number?
No. If you are a school or college and you have students here from wherever, they are in Tennessee, and so they become Tennessee's focus. So yes, you can provide your service to them. You don't have to track where they're from, or they're your students and you're in Tennessee, then they would be part of your funding.
Okay. This next question might need some clarification, but they say, have the estimated totals of grants exceeded 150?
Was that 150 million? Because I don't know. You know, if that's what's been allocated to the state. We don't have any way of knowing that, because we only know what we got. What we got in terms of the grants that have been sent. And again, it's only, what is today? Thursday. We still got 2 days left, so I really don't know.
What if we don't spend up to $25,000 by November 15th? Do we have to give it all back?
Yes. That one's easy. If you don't have to give the whole, if you, let's say you asked for $25,000 and you only have reimbursables for 20,000, then that's all you'd get paid for. You're not giving anything back because it's all reimbursable. But if you don't meet that number, which, you know, all kinds of things can happen, there won't be any penalty for that.
So in essence, for all those people who are wondering if they can apply for items below 25,000, is the answer really they apply for $25,000 and they only, right?
I refuse to answer that question, but
there you go, people. Loophole. On those infrastructure investments, can you clarify a bit more on purchases versus rental? Just making a compelling case why making a permanent investment in equipment, say a laptop, that may outlast COVID is preferable to upfront, shorter rental expense.
Yeah, I think that's a legitimate, if it's something that can be used after, we don't know how long this is going to last. We don't know how long the COVID will last. If it could last a couple of years, we could have another, who knows what could happen. So I think it would be easy to say, well, yeah, we can lease one for a couple of months and it will be cheaper, but we don't know what's going to happen. So I think if you're looking to buy something that could be used if we have another wave or something that goes past December 30th, that seems, appears to be a legitimate connection to the COVID crisis.
Yeah, so the next question has to do with vehicles in the same sort of way, right?
Mm-hmm. You can, the answer to that was a specific question because somebody had asked us that, is you can purchase a vehicle. In the case I'm thinking of was for medical transport, and the old one was just falling apart. That's one of those areas you would have to show, well, we could lease it for a year and it would cost this much, but what if something else happens? We may not have the funds to pay another lease. I mean, just something that indicates why would it be to the advantage of your residents or your participants to have something available when we don't know what the next crisis will be. I think that's a legitimate tie-in to COVID.
That concludes all of our written questions. How about that?
Ooh,
3:56. So we have time for a few more. If people have a question, you can unmute yourself and just ask it.
Go ahead. Do people have questions about why my cat keeps jumping on the chair?
It's wonderful, though.
So I have a quick question. This is Jim Staley, Goodwill.
Yep.
Since I totally confuse it, I'll try and be succinct and fast.
Okay.
one of the reasons I'm looking at the reimbursement side is because they're trying to pull something off, in the future that's impactful, but the timeline is so short, it's hard for me to push everything in there. So I want to be able to sustain it moving forward. So it's kind of one of these things. If we could recover all the stuff that we had to prepare for and protect us from COVID on a reimbursement of that PPE and things like that, then it will help with the sustainability of the program that I will budget, but it will reduce the cost of that program because I have to have it all that spent by November 5th, or technically, done by December 30th, but spent and invoiced by November 15th. Am I capturing that right?
Yes.
Okay, good.
Yeah, I think the big challenge for most people would be you can't prepay payroll. If you want to pay people through December ahead of time, that's probably not a good idea. But if you want to pay some other things, if we're purchasing food or some equipment or something that would last through December. So that's really the challenge. And I guess the only thing I can say is that if we keep in mind it's emergency assistance, that helps. It's not meant to go long term, even though you may wind up with some equipment or something that would last longer.
Everyone loves your cat, they're saying.
Who
Are there any other questions that we can help answer? I know people probably have them. No question's a bad question. Come on.
Well, and continue to email too, because we're going to be monitoring that mailbox. So.
We'll post that again in the chat. Well, there's a tncares@uwchat.org. That is your source for any further questions. We'll continue to answer those. Of course, the United Way has a landing page where you can access the application, and then Venture Forward has a landing page for any technical assistance. By the way, we are recording this, and that is where the recording will go. We will post that to Venture Forward's landing page as well. So we'll post those links back into the chat as well. Harping on infrastructure, my sense has been illustrating how this is an immediate response to COVID is crucial and have been shying away from long-term implications, but it would not be a negative to point that those longer-term effects out as well, correct?
That is correct. I mean, if you can show we were going to do this anyway for the short term and look at all the benefits we're going to have in the longer term, I think that would be a great approach. It's a great use of money, and the cat's name is Sam.
Wonderful. All right, last question. Come on.
Okay. Yes, Sam has some answers too, but if there's no last minute, I appreciate all the things that people have been sending and have been very kind and saying, being patient, and what is that saying I keep hearing about, or you're building the airplane as you're learning to fly it. That's exactly what's been happening. So we appreciate.
Oh, looks like Patsy froze. She just made it.
Finally caught up to her, unfortunately.
Well, that's okay. I think that's perfect timing. And I guess we'll get to look at her wonderful face for a little bit longer. But in the meantime, if you guys have any more questions, feel free to shoot us an email at that email. Check out the pages that Ada shared in the chat, and get your applications in by this Saturday. Okay.
And we can't say enough again to all of you on the call and who are going to watch this in the webinar. Thank you, thank you, thank you for your continued response to our community needs. Keep it up. We love what you guys are doing, and we want to try to do what we can to support you all. So just thank you again. I can't say it enough.
Yep. Thanks, Patrick.
All right. Until next time.